This module will review our Avatar same-day surgery shoulder replacement program. Avatar is a trademarked rapid recovery program. It is an acronym that stands for Alignment of Vital Assets to Accelerate Recovery. This recognizes that joint replacement surgery is a complex process that involves many aspects of care. The surgery itself is only one asset in this process. While a properly performed surgery is important to outcomes, all other assets must also be aligned to ensure the best possible recovery. Avatar is about customizing each of these assets to a patient's individual needs and putting together a pathway that leads to better quality care and higher patient satisfaction. Our goal is to help navigate each patient through the entire process and let nothing fall through the cracks. With our program, most people can go home the same day and recover in the comfort of their home. The definition of the word avatar is the embodiment of a concept or philosophy in a person. The goal of joint replacement is to restore you to the activities you love and have missed because of arthritis. My avatar is who you want to be when your arthritis pain is gone. Achieving your avatar takes a commitment on your part to regain strength and function after surgery. This is not automatic. Define your avatar before surgery so you can set goals for your new joint. What is patient activation? When patients get actively involved in their preparation and rehabilitation, the chances of a successful outcome are greater. There is no surgical technique, technology, or navigated care plan that can compensate for lack of motivation to succeed. The decision to undergo joint replacement must include a commitment to actively participate in the outcome of surgery. Joint replacement simply sets the stage for what patients can achieve through persistent dedication to the rehabilitation and recovery process. Own your outcome. With the Avatar program, an overnight stay in the hospital is no longer necessary for most patients. Who can achieve this? Motivated patients who do not have any major health problems that require inpatient monitoring are eligible for same-day surgery. How do we do this? With the use of multimodal pain management, regional nerve blocks, long-acting local anesthetics, and medication to limit blood loss, most patients can be dressed, walking, doing stairs, and heading home within a few hours after surgery. After surgery, patients must demonstrate that they are sufficiently recovered to be functional and safe at home. A total joint coach or support person must be available to drive the patient home and spend the first 1 to 2 nights after surgery. With our Avatar program, nearly 100% of our shoulder replacement patients have been able to go home the same day as their surgery over the past few years. As of 2024, the Center for Medicare/Medicaid Services, also known as CMS, has approved shoulder replacement to be done in an outpatient surgery center. Unless there is a medical contraindication to performing surgery in an ambulatory surgery center, most of our patients will be scheduled at either Atlantic Coast Surgical Suites in Seabrook or Stratham Ambulatory Surgery Center in Stratham, New Hampshire. Multiple studies have now demonstrated that it is as safe or sometimes even safer to go directly home after joint replacement than to spend 1 to 3 nights in the hospital. The following are benefits that our patients have reported in going home the same day. The comfort of your own bed, leading to better sleep. The comfort of your own home, leading to less stress. Full availability of your coach. Home-cooked food. Better ability to control your pain in real time. Better ability to self-manage any medical issues such as diabetes. A lower risk of infection. Better ability to mobilize since there will not be lines and monitors hooked up to you, and less noise and fewer people coming in and out. It is important to have someone who can help you through the entire care episode of joint replacement from preoperative preparation through recovery. Your coach can be a spouse, family member, partner, or friend who can assist you, provide a second set of ears, ask relevant questions, and motivate you to succeed. Recruit this person in advance and engage them as part of your care team so that they can be part of your success story. For many people, the process of undergoing joint replacement can be overwhelming, and having a critical support person can have a tremendous positive impact.